My name is Billy Triplett. I'm from Morgantown, West Virginia here, and I'm a salesman for a local crane company. When I turned 40 years old, I'd had an issue with my right hip. It was just aching all the time. Finally, I went and got checked, and turns out that I did need a hip replacement. Had that one done, and it only took me 3 or 4 days for that one, and I was good to go. Whenever this one started to go bad as well, I knew the symptoms well ahead of time, what was going on. They gave me some information to read over and go through, and then they had me come to their joint camp. The joint camp is where everything was laid out, and I think it was about 30 days after that, I came in for the surgery. Day of surgery, I was supposed to be here, I believe it was 7 a.m. that morning. Came in anxious, ready to get things started and get it, I knew what to expect because I'd been through it. He brought me in, talked to me, took me back. Pretty much the next thing I remember is waking up in recovery, getting up and walking in about 20 minutes, and going home 3 hours later. There was no anxiety at all from my side. I was excited to get in here and get it done because I had such confidence in just speaking with him about, my knee when I had an issue and now the hip, and hearing his background, I knew I was in good hands. Well, I would tell anybody if they're to that point of needing joint replacement, just speaking from hip-wise, definitely do it. There should be no nervousness because the pain you're going through now, when this is done, I said it on my first hip 10 years ago and this hip 2 months ago. I shouldn't have waited. But knowing that that's not here now, honestly, it's like knowing that you got a good car that'll always start for you. You know what I mean? So, yeah, it's a good thing.